neutral and implemented video conferencing as part of their corporate responsibility program. They chose Lifesize as their vendor for video deployments. And post that, a few things changed in Caroline's life. One was the way she did business. It was not catching a plane, sleeping in hotels, doing meetings, and not seeing her husband for a long time. She actually started doing more meetings, managing time more efficiently, and was able to do much, much more. She then had a baby, so she had to stay back home. Now, when you talk of Caroline's husband, Paul is a consultant pediatrician and consults in a number of leading hospitals in London. Paul is responsible for the Medical Trust Modernization Program, bringing technology to the hospital to improve lives of the staff and patients. In a normal week, when you look at it, Paul visits about 6 hospitals, as well as spend a day at teaching at hospital training for next generation of doctors to become. So this is part of his story and part of most doctors' everyday life. He has an early start to his day, starts 6 a.m. with breakfast. Every day at 7 a.m., hospital sends a driver to pick Paul. This gives him a chance to review patients' notes quickly on the way to work. As part of his rollout of our technology, all daily updates of patients' cases are recorded on a product of ours called Video Center. Using his iPad and his 3G connection, he is able to review patient records and associated video notes on the way to work. At 9 a.m., he is then scheduled to perform an operation on a patient with a very rare condition. Paul sends out invites through his iPhone to colleagues to view their upcoming surgery, and also wants many students to view this rare surgery. At the same time, he also sends requests to the system so that the procedure gets recorded and is streamed to other students for review later. All of this is booked using his Google Calendar. That's the internal email calendar and meeting system used by the hospital trust. Through the control system, he can integrate Google Calendar for companies who have moved to cloud computing platforms. One meeting invite does it all. He schedules a meeting on Google. He invites people to view the conference. He sends a message into the control to record the conference and to stream it at a later date. At 11 a.m., the hospital has installed another video center to allow parents who cannot be at the hospital 24 hours a day to see live streams of their children while they undergo intensive care. Each of the 15 ICU stations has a video unit with a focus camera installed and local recording running 24/7. By using this channel on the Lifesize Video Center, the parents can share their children with their other relatives as well. During his lunch break, Paul calls his wife Caroline at home. As she is now working 2 days a week from home, she is able to take his call from his desktop video system at home. Paul's desktop video system connects to his wife via a transit server using safe firewall traversal technology. At 2 p.m., Paul returns to reviewing patients' notes. He notices something very disturbing and needs a second opinion. Paul sends out a mail to colleagues who link him by joining a meeting via the Lifesize bridge. Each consultant has his own private meeting room set up on the bridge and available for ad hoc dialing 24/7. The trust provided each consultant with whom Paul consults with a copy of a desktop software where they could use video conferencing across Windows or Mac. While the training is going on, Paul completes the recording and keeps it available for all students to view. "7 p.m. Paul heads home after a long day at work. In the evening, while relaxing, he reviews video patient records ready for tomorrow. Video recordings have augmented existing patient records, reducing the paperwork needed and saves time." So, to all of y'all, does that sound like science fiction? Well, it's not. It's technology that saves lives. It's an end-to-end solution. And it's the brand new platform that we've launched, which is called UVC, Universal Video Collaboration. It's an all-in-one system, multiple applications, one platform. So rather than having multiple boxes occupying huge spaces in your data centers, we've come out with an all-in-one box solution. We give it as an appliance or as a software. You run it on VMware, and you have all applications integrated in one. I'm going to end this with a small video that shows you how this technology works for healthcare, technology that works for you, and technology that saves lives. Video.
The first one, second one?
No. Which is the folder? Yeah, I need this one.
I'll put the mic, not a problem.
Office hours, so it checks the life-size ClearC contact list to see if his doctor is available. With luck, the doctor is in, so he initiates the video.
I think we're having system problems here, but this video is anytime, anywhere. We are not agnostic to only giving one kind of technology, any device, anytime, anywhere. Thank you.
Almost there. Last session of the day. And no better than Ananta Padmanabhan to talk about the use of barcode in Indian hospitals. So we'll hear from someone who runs a real hospital to tell us about the use of technology.
I think Mr. Prem and Adi felt that I should be the last speaker in the last session. They must have had three reasons. One is they should have thought that Ananta Padmanabhan is a very powerful speaker. Believe me, I am no Mr. Sangeeta. Number two, they would have thought maybe barcode is a very, very interesting topic, and so we should keep it to the last. Believe me, it is. Or they should have had the last reason. So much is talked about the tier 2 cities in India, and after all, this fellow has come from Trichy and Madurai and Coimbatore. We should give it a try. So I think that's why they should have given me the last session, but I hope you'll find this interesting. And believe me, I've always felt that technology can transform the way we work in the hospitals. And I cannot forget what Narasimha Rao, when he was the Prime Minister, and when he was addressing the NASSCOM meeting once, he said that if he had fought the British with the cannons instead of swords, our destinies would have been different. I think that way, the IT in hospitals has changed the way we are working. And maybe if you ask me after 25 years, will you work in a large hospital without IT, I would say rather no. I would be rather without a job than working without IT in a hospital. Okay, what I'm going to quickly do is I'm going to take you through some of the hospitals in India which have used this barcode technology and which have really used this barcode technology. And of course, I'm not going to talk much about RFID technology because I believe that RFID technology is still in the process of evolving around the world and not so much used in even in the Western countries, and maybe it would take another 5 or 6 years before we could see the RFID technology mature in India. But one thing I can tell you, these barcodes are going to simply revolutionize the care we give in India. This barcode technology uses a very, very simple principle, and it could really reduce the waiting time for the patients. It could improve the outcomes, clinical outcomes in the hospital, and it can also serve as a very good payment mechanism which is being used. And I'm going to quickly show you some of the applications in various hospitals, and you will really appreciate them. This is one of the hospitals which uses where I am working. This is, very interestingly, I found that All India Institute of Medical Sciences is using this technology very well, and I specifically went there to see for myself. I saw it in the papers that there was a press report saying that they are using an e-purse kind of a facility using this card system, and I wanted to see it, and I really appreciated what they are doing. I'm going to show it a little later, and this is another hospital where I work for